Welcome to another episode of the Med Madness podcast, your go-to resource for mastering the intricacies of the USMLE Step 2 CK. In today's episode, we're diving into an essential topic in medical ethics, advanced directives and surrogate decision makers. Understanding this topic is crucial for medical students and professionals as it directly impacts patient care, autonomy, and legal responsibilities in clinical settings. Advanced directives and surrogate decision makers ensure that a patient's wishes are respected when they cannot communicate them themselves. This topic is particularly important for medical students to grasp because it involves navigating sensitive situations and making decisions that align with the ethical and legal standards of medical practice. In this episode, we will cover the hierarchy of substitute decision makers, criteria and selection process for next-of-kin surrogate decision makers, scenario analysis of a patient in hemorrhagic shock with religious objections to blood transfusions, pediatric considerations, and family-centered advanced care planning, and key points about advanced directives, including living wills and healthcare proxies. Next, let's understand the hierarchy of substitute decision makers and their roles. The hierarchy is designed to prioritize who should make decisions on behalf of an incapacitated patient. The highest authority is the patient-designated proxy, such as someone with durable power of attorney. If the patient is unable to designate a proxy, a court-appointed guardian takes precedence. In the absence of these, the next of kin acts as the default surrogate. This usually follows a specific order: spouse or partner, adult children, parents, adult siblings, other adult relatives, and finally, unrelated friends. Next, let's discuss the criteria for the next of kin surrogate decision maker. When a patient cannot communicate their wishes and no advance directive is available, the next of kin surrogate decision maker steps in. The priority typically goes to the patient's spouse, followed by adult children, parents, adult siblings, and other family members. The primary goal is to make decisions based on what the patient would have wanted, known as the substituted judgment standard. If the patient's preferences are unknown, decisions should be made in the patient's best interest. Consider a real-life case study. Imagine a patient in hemorrhagic shock who is minimally responsive. The medical team begins a blood transfusion, only to later learn that the patient's religious beliefs prohibit this treatment. Without an advance directive or a blood refusal card, the default surrogate decision maker, in this case the patient's wife, must make a decision. She uses her intimate knowledge of her husband's wishes and opts to stop the blood transfusion, but continues other life-sustaining measures like intravenous fluids and vasopressors. This decision is guided by the substituted judgment standard, prioritizing what the patient would have chosen. Next, let's explore pediatric considerations. In pediatric patients, particularly those with chronic or terminal illnesses, it's crucial to balance respecting the parent's authority with being honest with the child. For example, in a patient with cystic fibrosis who is experiencing increased pulmonary exacerbations, the discussion about advanced care planning should be family-centered. Involving the adolescent in these discussions respects their developing capacity to understand their condition and preferences, which can reduce anxiety and improve quality of life. Now, let's cover the key points about advanced directives. Advanced directives are legally binding documents that outline a patient's preferences for medical treatment. They include living wills, which specify consent or refusal for certain medical interventions, and healthcare proxies, where a surrogate decision maker is designated. These directives take precedence over family or friends' preferences and ensure that a patient's autonomy is respected even when they cannot voice their wishes. In summary, understanding the hierarchy of substitute decision makers, criteria for next of kin surrogates, and the roles of advanced directives is crucial in ensuring patient autonomy and ethical medical practice. We explored the importance of substituted judgment and the best interest standard, particularly in sensitive scenarios like those involving religious beliefs or pediatric patients. Thank you for listening to this episode of Med Madness. Don't forget to engage with our pre- and post-podcast quizzes and use the Anki flashcards to reinforce your learning. These tools are designed to help you effectively study and master the material for your USMLE Step 2 CK exam. Stay tuned for more insightful episodes, and until next time, keep learning and stay curious.